Hi, good morning. This is Susan O'Neill with the Department of Family and Support Services. I'm a project coordinator, and also we're going to be doing a training today on ensuring accessibility for persons with disabilities in Chicago's DFSS-funded homeless shelter. Today we have two speakers from Corporation for Supportive Housing, Jonna Lowe
and Stephanie Seidman.
Oh, okay. I'm sorry. We want to let you know that there will be two Q&A sessions, one in the middle of the presentation and one at the end. On the right-hand side of the screen, you can write out your questions and we will, of course, answer them for you. If we don't know the answer, then I will get back to you as quickly as possible with answers.
On today's webinar, we are going to cover the intent and purpose of the new policy, discuss the key concepts and definitions, as well as present the policy and forms. We will also have time for people on the webinar to ask questions, as Susan mentioned. Once again, this is Jonna Lowe from the Corporation of Supportive Housing. I just want to give you a couple details about our organization. CSH is a national nonprofit consulting firm that works to end homelessness and sees supportive housing as a key and pertinent solution. We have been in operation since 1991 and have focused on work around improving the lives of vulnerable people, maximizing public resources, and building strong and healthy communities. Once again, I'm Jonna Lowe from the Illinois team at CSH. We are contracted by the Department of Family and Support Services to provide technical assistance, capacity building, and support in the homeless and supportive housing sectors. When I first started working in this sector and understanding issues of access, I often heard people ask, what is 504 and why do I keep hearing it? Within the Rehabilitation Act of 1973, Section 504 was the first of the disability laws to be enacted. It prohibits the practice to discriminate people with disabilities in programs. It is important to be clear in defining a disability. Oftentimes we use the term in various ways. The following definitions help explain the underlying terms in this definition of a person with disability. Physical or mental impairment includes any psychological disorder or condition, cosmetic disfigurement, and anatomical loss affecting one or more of the following body systems: neurological, musculoskeletal, special sense organs, respiratory, including speech organs, cardiovascular, reproductive, digestive, genitourinary, hemic and lymphatic, skin and endocrine, or any mental or psychological disorder, emotional or mental illness, and specific learning disability. The term physical or mental impairment includes but is not limited to such diseases and conditions as orthopedic, visual, speech and hearing impairments, cerebral palsy, autism, epilepsy, muscular dystrophy, multiple sclerosis, cancer, heart disease, diabetes, mental retardation, emotional illness, drug addiction, and alcoholism. Major life activity means functions such as caring for oneself, performing manual tasks, walking, seeing, hearing, speaking, breathing, learning, and working. And also has a record of such an impairment means as a history of, or has been misclarified as having a mental or physical impairment that substantially limits one or more major life activities. Is regarded as having an impairment means has a physical or mental impairment that does not substantially limit one or more major life activities, but that is treated as though it constitutes such a limitation. Has a physical or mental impairment that substantially limits one or more life activities only as a result of the attitudes of others towards such impairment, or has none of the physical or mental impairments defined above, but is treated as having such an impairment. Note that the term person with disability does not include any individual who is an alcoholic or drug user whose current use of alcohol or drug prevents the individual from participating in program or activities in question, or whose participation by reason of such current alcohol or drug use could constitute a direct threat to property or the safety of others. Also be aware that shelter operators must not refuse to serve an otherwise ineligible client because of fears or concerns that may be based on myths or stereotypes about persons with particular types of disabilities. The information comes directly from HUD. You can visit the site on the following link. Please note that the Section 504 defines disability differently from HUD's homeless programming. It is a more restrictive definition. Note that the person with disability does not include an individual whose currently use of alcohol or drug prevents the individual from participating in the program or activity in question, or whose participation by reason of such current alcohol or drug use would constitute a direct threat to property or the safety of others. Also be aware that shelter operators must not refuse to serve an otherwise eligible client because of fears or concerns that may be based on myths or stereotypes about persons with particular types of disabilities. The Department of Family and Support Services is committed to ensuring that all homeless persons have access to homeless service shelters and related services. To achieve this goal, DFSS has established policies to ensure that people with a range of disabilities, including mobility impairments, sensory impairments, both vision and hearing, and mental impairments, have access to shelters and associated services in accordance with 504 of the Rehabilitation Act of 1973. In understanding Section 504, it requires the Department of Family and Support Services and its delegate agencies to take proactive steps to ensure equal access for homeless persons with disabilities, as long as actions do not require a fundamental alteration to the program or impose an undue financial or administrative burden. This means that DFSS and delegate agencies must ensure that homeless persons with disabilities are able to request shelter, access shelter, and benefit from services provided in shelters. DFSS is also responsible for reporting to federal funders on its efforts to ensure program access for persons with disabilities. Delegate agencies are required to provide the shelter level data needed for DFSS to accurately report the aggregate information. This means that 504 prohibits discrimination on the basis of disability in a program or activity that receives financial assistance from HUD. In this slide, we just want to clarify the difference between Section 504 and the Americans with Disabilities Act. As we mentioned, the Section 504 was started in 1973, and the ADA was started in 1990. To clarify, once again, 504 is reasonable accommodations for persons with disabilities to access things, and we consider those things to be service centers, services, housing, and others. These policies are enacted in the housing sectors that include those systems people engage in before permanent housing. These programs are often referred to as delegate agencies. Shelters must not refuse to serve an otherwise eligible client because of fears or concerns that may be based on myths or stereotypes about persons with particular types of disabilities. DFSS and sector staff are using past experiences to learn from and create consistent policies to be equitable in access to services. So what does this mean to DFSS? DFSS is working to ensure that persons with disabilities have access to its emergency homeless shelters and programs, and to document compliance with Section 504 requirements. We will go into more detail of each of the four following categories. System-wide approach to accessibility, ensuring that DFSS shelter system as a whole meets the needs of people experiencing homelessness with disabilities, including providing services that are too complex or expensive for any one shelter to provide, but that are feasible for DFSS to provide through a centralized process. Number two, specializing adequate accessible facilities. Ensure DFSS system and adequate accessible facilities to meet the needs of persons with disabilities and for matching persons with disability with appropriate shelters. Number three, overseeing delegate agency compliance with Section 504, ensuring that the delegate agencies following the policies and procedures ensure that the delegate agency following the policies and procedures and fulfill the responsibilities under Section 504. And number four, collecting data, analysis, and reporting, ensuring that it effectively maintains and consistently improves access for persons with disabilities. DFSS requires each funded delegate agency to structure its program to impose as few barriers as possible for persons with disabilities, and to make reasonable accommodations to allow persons with disabilities to participate fully in those programs. However, not all shelters within the DFSS system must be fully accessible to persons with mobile or sensory impairments, and each shelter has a capacity to accommodate different types of requested accommodations. Centralized services. Some services may be needed to follow persons with disabilities to fully access DFSS delegate agencies, are beyond the scope of what individual shelters is likely to be able to provide. The following centralized services are available through DFSS. Coordination to match persons with disabilities with shelters that can best meet their disability needs through the mobile outreach team. Accessible transportation to transfer people with mobile impairments to accessible shelter facilities, and that TTY and TDD devices to permit callers with hearing impairments to access assistance by reaching DFSS centralized intake system. Deployment of sign language translators to shelter sites if needed to assist a person with a hearing impairment. An effort to obtain specialized support not included in this list is required to meet the need of a person with disability. DFSS centralized services or requested specialized support on behalf of a client with a disability by contacting the mobile outreach team.
We'd like to talk specifically about how this relates to you. So Jonna gave a beautiful overview of what is 504 and how does this relate to the system at large. And then this is where you come into that system at large. So welcome. For your organization and shelter program, it's imperative that persons with disabilities are able to request shelter, access shelter, and benefit from services provided in shelters. So essentially what this means is that people impacted by a disability have access and equity like everyone else in Chicago who might be seeking shelter services. There are handouts on the right side of the screen under handout, very well named. And one of those looks at the final DFSS policy on Section 504 that we're going to be referencing, so I want to make you aware of it, along with a request for reasonable accommodations, which is within that policy on page 22, but also its own handout if that makes it slightly easier for you to find it. Sometimes people are told, pay full attention and don't multitask, but it would be highly appropriate to pull some handouts up and look at the policy that we're speaking of. And just to give you a little bit of an overview of what you're looking at, there are handy references included. Section C looks at meeting the needs of persons with disabilities every day, we're going to be talking more about reasonable accommodations and how you can help people request reasonable accommodations, what may happen if you need to deny a request for those accommodations, and what to do with your documents and definitions and key concepts are outlined in the DFSS policy on Section 504. So Section 504 does not require every aspect of a covered program to be fully accessible to persons with all types of disabilities. Instead, it requires that the program or activity, when viewed in its entirety, so think the Chicago shelter and interim housing system, be accessible to and usable by persons with disabilities. For shelters, oftentimes that has to do with intake, services, sleeping accommodations, and the like. And it's important to note that not every program can be accessible to all persons, particularly with mobility challenges, though our system must be accessible to all persons and allow, for example, if a particular shelter is not able to accommodate a person in a wheelchair, a different shelter can, which is what makes the system overall accessible. When you think of what it might look like in your shelter, questions you could ask yourself are, how do we meet the needs of persons impacted by various types of disabilities? And you may have really strong examples as they relate to mobility, hearing needs, vision needs, persons with cognitive impairment, where, for example, you may not have read the HMIS consent word for word or asked the person to do so. You may have had a conversation about the key points of the Homeless Management Information System consent to ensure that a person who you believe may be presenting with a cognitive impairment understood what they were being asked to consent to, as opposed to assuming literacy levels and the like and asking someone to read for themselves and sign. Within the DFSS homeless program as a whole, people can be either offered a particular shelter because there already is knowledge that this person's need will be best accommodated in a particular place, or it might be that anyone could accommodate the person and we're all just working together to ensure that that's what's taking place. So part of this 504 policy suggests it's really important that people are in their most integrated setting. The idea is not to group all people impacted by disabilities in a particular location, but really just to ensure that people can access the services and supports that they require in the community. So just to take a moment to discuss the most integrated setting means that people impacted by disabilities are also with people who are not impacted by disabilities, and that we are all in community together. So we'll take a pause now just to comment that there is a handy chat box on the bottom right-hand side of your screen. And if you have any questions or want to offer a comment, we would invite you to go ahead and type that into the chat box or into the box called questions specifically. And that will allow us in a few minutes to go ahead and take a break from our presentation and address any question or comment that you would like to see addressed during this webinar. Next, we'll be discussing reasonable accommodations, and Jana certainly mentioned this earlier, but just to go into a bit of a definition and also what that may look like for you. Reasonable accommodation or adaptation, or could it be modification, looks like something that your shelter can offer oftentimes without cost, just with some insight into how to have a productive conversation with a participant to better understand what their needs are so that they can fully participate in your program and not be left out of services that they otherwise may benefit from. The next definition that we want to go ahead and take a little deep dive into would be fundamental alterations. So these are actions that would result in a fundamental change in the nature of your program, such as actions that would require substantial modification or the elimination of essential program requirements, actions that would require the provision of supportive services not provided to individuals without disabilities. Just to give an example, if a person requires a visit to a nurse, you are not being asked to now provide nursing services through your shelter, though you might be asked to ensure that this person is able at the times necessary to go and access that nursing service. If there is a visiting nurse, that nurse is allowed to visit them at the shelter. And this is of no cost to your shelter, but simply that a reasonable accommodation could be made without fundamentally altering what services you provide. If it's really very different than the nature of the type of program that you offer in terms of a request, and it looks like you wouldn't be able to honor that reasonable accommodation because it fundamentally changes your program, typically that would involve a conversation with how can this person have their needs met. Possibly not through you, but it could be facilitated by you, either at a different location or with another entity providing an on-site support. The next important definition is undue financial and administrative burdens, because there are times when it wouldn't be a large change to your service structure like a fundamental alteration. It would be something that is simply too costly to accommodate at your location. And in these types of cases, and you look at just one at a time, usually has to do with factors such as the cost of the accommodation, financial resources of the provider, benefits the accommodation would provide to the client, and the availability of alternative accommodations that would adequately meet the client's disability-related needs. As an example, you may operate an emergency shelter or interim housing program that does not have an elevator and does have a second floor. In that case, if you also have sleeping rooms on the first floor and services that can be offered on the first floor, you would be able to meet the needs of a participant with a mobility challenge that would make it difficult to get to the second floor. If all possible sleeping accommodations are on the second floor, the assumption is that you could not afford to install an elevator, but that DFSS could route a person to a different shelter who would still be able to access the services and supports that they need at a location that could be accommodating. The next piece we want to look into is auxiliary aids and services. And auxiliary aids are devices that support people with impaired sensory, manual, or speaking skills to have an equal opportunity to participate in and enjoy the benefits of programs or activities receiving federal financial assistance. There are quite a few examples of what auxiliary aids could look like, and the woman in this photo is using a straw in order to drink from her cup of water, which is a fairly inexpensive auxiliary aid that many people use for a variety of reasons, and some people use because it is related to the nature of their disability. Other examples could look like if a person has a vision impairment, braille materials, audio recordings, just speech in general. People might not need to read something, you could talk them through it, or other similar devices. Auxiliary aids for persons with impaired hearing have a very wide range, from telephone handset amplifiers to telephones compatible with hearing aids to telecommunication devices. I'll say that when I worked as a case manager at an emergency shelter with a deaf participant who happened to be able to write, we simply wrote to each other. And when we found that we both typed faster than we wrote with a pen, I would just pull up a Word document, we would sit at the computer, and we would type to each other. That was just a faster way for us to communicate together. There was no need to have someone who could interpret for us come, and that actually made it a bit more convenient for us to meet when this person wished to meet, as opposed to at a particularly scheduled time. And we understood each other without any device or any cost to the system. This was not something the person had said, I will require a reasonable accommodation for, because people don't often speak in those terms. It was just simply evident that we weren't going to speak to each other, and we found other ways to communicate. But that writing back and forth, just using a Word document, for us was the only auxiliary aid that we needed. For some people impacted by a disability, they may have a service or companion animal. And so we wish to spend a bit of time talking about the difference between the two and how emergency shelters and interim housing programs can navigate this particular support. So the definition of service animals, if you haven't heard this lately, actually does include the word dog. That is an assumption built in. So service animals are defined as dogs that are individually trained to do work or perform tasks for people who are impacted by disabilities. Service animals are working, and they're not pets, which is to say that if you have a policy that people may not have a pet, that does not extend to dogs who are working as service animals. The work or task of a dog has been trained to provide must be related to the person's disability. So just to give some examples of work or tasks, the most commonly referred to task would be guiding a person who's visually impaired. Sometimes they're used to alert people who are deaf of an emergency. Sometimes dogs pull wheelchairs. What I find incredibly fascinating is that dogs can be trained to tell the warning signs of a seizure and can be trained how to find help even before the person knows they will have a seizure or has started to have that seizure. They can be used as alarm clocks that can remind a person with a mental illness to take a prescribed medication. More and more often they're being used as calming agents, such as for persons with post-traumatic stress disorder. The idea being that if I'm personally impacted by PTSD, I may be in a moment that was 2 years ago, and I might be spiraling and having a difficult time coming out of that moment that was traumatic for me 2 years ago. And my service dog could bring me back to the present. He might lick my face or in some other way confront me to recognize I am not there where I was at that time of trauma. I am here in the now. Service animals are, again, working animals, and specifically they are dogs. Companion animals may not be a dog. They're assistance animals that provide comfort or emotional support. So they don't meet the criteria of service animals, but allowing their presence may be a part of a reasonable accommodation. And so this is a very sort of key difference. A person cannot be denied access with their service dog. A person with a companion animal should request a reasonable accommodation if they feel this animal is necessary for their participation in the program. A delegate agency's rules, policies, or practices must be modified to permit the use of a companion animal as a reasonable accommodation when its use may be necessary to afford a person with a disability an equal opportunity to use the shelter and/or services. Questions that shelter operators may ask to determine whether an animal should be considered a service animal or companion animal include, is this an animal whose services are required because of a disability? It is not permissible to ask, tell me, what is the disability? Some people may disclose voluntarily, but it's not acceptable to specifically ask the person that question. Simply, are their services required because of a disability? What work or tasks has the animal been trained to perform? And the following issues, can come up with either service animals or companion animals. Sometimes the fear is that people do have allergies, and there may be a concern for other participants in the program, instead of denying access or refusing services, for example, to a person who uses a dog, a service dog, to guide their entrance, it might just be a question of looking at how they can be separated from a person with an allergy, because both do need to be accommodated. Both need to be accommodated in the larger general system as well. So if there are multiple participants with extreme fear or allergies, it may be a question of how DFSS can look at proper placement for all participants so that everyone is able to have access. A person with a disability cannot be asked to remove a service or companion animal allowed through reasonable accommodation from the premises unless the animal is out of control and the handler does not take effective action to control it. So for example, if someone requests a reasonable accommodation, it's determined that the companion animal is necessary for the person to be able to access shelter, and then that companion animal bites a person at the shelter. That would be an example of unnecessary removal because it is now a safety issue for people at the program. If the animal is not housebroken, that's also an acceptable reason to deny entrance for that animal, because it is an expectation that the person with either the service animal or companion animal would be able themselves to help bring that animal outside, or that they have a plan in place that does not involve shelter staff for doing so. So when there is a legitimate reason to ask that a service or companion animal be removed, staff must offer the person with a disability the opportunity to obtain services without the animal's presence. In other words, if my companion animal is no longer welcome, I must still be welcome. I may choose not to stay without my companion animal, but the companion animal needing to leave does not mean that I also need to leave the shelter. So we've mentioned this a few times, and just to get into some more examples, there are, of course, reasonable accommodations that can be made in your program. There are also modifications, and I want to clarify the difference between the two. On the accommodation side, it might be a change in a rule or policy or how you are providing services. Some examples might be that there's a service offered in a way that is more appropriate for the person impacted by a disability, as opposed to how that service is always offered. If a person is not able to participate in mealtime because of their sensory needs, but of course will need to eat, perhaps instead of saying this is when mealtime is, it might be that there's actually a different mealtime for this person so that they can access food safely. Accommodations typically do not require any funding at all. They simply require a change in approach to accommodate. Modifications often do require a tool or resource or funding of some kind. So examples could be a structural change to the premises, such as a ramp that's put in. Perhaps there are modifications made to restrooms to ensure persons with mobility challenges or sight or hearing challenges are able to equally access all parts of your program. And modifications might be best suggested by the person impacted by a disability. Even if they are not sure of exactly what they need, it's very worthwhile to have a conversation about what the challenge might be, and then to brainstorm what type of modification, oftentimes they are very low cost, might need to be made. So that brings us to our question and answer, middle of the webinar session, for us to just take a look at anything you've written or you would like to write now, with any questions or comments you have. So if you haven't had the opportunity to type something in that you would like to see addressed, we would just want to invite you to go ahead and do so now.
We noticed a couple attendees raised their hand during the presentation and webinar. We just want to offer this time to ask those questions in the questions comments. So please feel free to type those questions in now for those that had their hand raised previously.
So one participant asked, does the person have to have a diagnosed disability for us to meet this accommodation? That's a terrific question. And with the low barrier approach, it is not necessary for a person to prove that they have a disability. It's also not necessary for the person to share their disability. It's only a requirement that the person asks for what they need that is related to a disabling condition. And questions might look like, how will such and such an accommodation help you to access this location? But we couldn't require for someone to prove a disability that they are not actually required to disclose. If you have a follow-up question related to that, please feel free to type in again, and then we'll just look to see if there are any other questions. Okay, if you do think of a question, please feel free to type, because we'll make sure to take a break again to answer anything you'd like to discuss. Oh, someone just typed in. Well, let's take that break now. The question is, what documentation for the service animal can be asked? It's a really fascinating question, because you cannot require documentation. So therefore, the most important piece is going to be the conversation. I will say service animals are dogs that wear something that indicates they are a service animal. So you can most often tell the dog is a service animal by a vest that he or she is wearing, by a collar that specifically invites people to understand they are working, not to pet them. Typically there is something highly visible on a service dog, making it obvious. But if a service animal is not wearing something like this, and possibly more likely a companion animal at that point, because service dogs so typically have gear. The question really is, in what way will this companion animal support your access to shelter? What are they trained to do that you require? And can you demonstrate, for example, such and such a task? Someone will not be able to demonstrate alert like that they may alert the person of seizures. So we have to be reasonable too. But if the person says, for example, I cannot open doors, and they open a door, it would be a reasonable expectation on your part to see that take place. And that's one other question.
We see we have another question that asks, are we expected to provide the additional staff to assist a disabled person? We once had a client who insisted we help her get to the restroom, get out of the bed, etc. We lacked the staffing to address this much direct care.
It's a great example of a very difficult situation. If someone requires more staffing than the shelter has, we would recommend contacting DFSS directly. It might be that there is another shelter placement that would be more appropriate, or that there's in-home health care opportunities that could be brought to a shelter setting. I don't wish to assume this person was a senior citizen, though if that is the case, the Department of Aging would also be a good resource for an aid or doors might be a good resource if the person is Department of Rehabilitation might be a good resource for people who are not. I think the question is who could help this person. It may not be shelter staff. It really might be if this person wishes to be in a shelter setting as opposed to in a nursing care setting, which is not their most integrated possible setting, and it can be made possible by supports. Are there any outside entities that can help provide that support? And DFSS is an excellent place to start with brainstorming that process. Oh, one person wrote in, I don't think there is any documentation that a service animal is provided to their owner. Thank you. Yeah, thank you for that. Yes, I mean, most often service animals are wearing their documentation, typically in the form of a vest. So thank you for typing that. Okay.
We have another question that asks, our sleeping area is separate from the common space, which we close after the clients get up. Would we have to open that space for the disability that required that? That's a good question.
I think shelter programs are very creative with space. And so, you know, we've seen in some programs, there has been a space created for sleeping that was not initially intended to be a space for sleeping because it was required, often related to mobility. If your question is more so related to a person requiring respite and unable to get up, that might be a little bit different than where in the building can someone rest. But I think that what you're referring to now is getting into services of the program. And so you might look at, would doing so fundamentally alter your services? And if it would, it is not an expectation that you do so. If it would not fundamentally alter your services because there's some way to still accommodate this person and offer services, then you may be able to find this accommodation. I will say for this excellent question, and thank you for asking it, that you are going to find probably just as often as not that a follow-up conversation about how to meet an accommodation is required. And so we are so delighted to offer this webinar, but just wish to reiterate that that would be something to come to DFSS with, to say, we think this is fundamentally offering our service package if you believe that. So this is why we would deny, and does that sound right? People can appeal, but it might be a different program might make more sense, or a different sleeping quarter. And if there's no other sleeping quarter in your location, perhaps there is in a different location. So that gets us back to our webinar. Thank you. Those were really terrific questions, and keep them coming. And we're looking now at reviewing content of the policy and forms. This one. There we go. I had to get myself back on the right page. So the idea is that you may need to adjust standard operating procedures in some cases, and they may be small adjustments that allow people impacted by disabilities to be in an integrated setting. In this case, we're saying to be in, for example, an emergency shelter instead of in a nursing home or nursing care environment. We certainly need to ensure emergency safety evacuation plans that do address the needs of all people. So just as an example, some shelters may have an alarm system that blinks in a way that a person who is impacted by a hearing impairment would still see that there is an alarm. Even so, that may not be enough to wake a person up from their sleep. So it could be that a person with a hearing impairment could access shelter in any location so long as overnight staff were aware of who would not hear an alarm go off, and that there be special consideration for how to wake and help move people on their way should everyone need to evacuate the premises overnight, such as a fire alarm or something like this. And the idea is that you would look at your own practices, your own operating procedures to see, are you equipped to accommodate people with any type of disability? Not do you have people with these disabilities currently in your shelter, but what would you do if, to ensure that you're not having a brainstorm session at night now that a new person has arrived, but that there are some procedures in place to ensure for important pieces such as emergency evacuation. When we get into reasonable accommodations, what's particularly important is that participants are made aware that they may request accommodations. Oftentimes people who do require some type of accommodation will not request it, and if only asked, do you need a reasonable accommodation, may say no. And so there needs to be some engagement, particularly when it is entirely evident that someone may require some additional support, that person is approached beyond are you aware that you may ask for reasonable accommodation. It may take more of a conversation about what that could be, such as I would like to know if there are any needs of yours that have not been met in shelter in the past, or I see a need that I wonder if you would like to address, and we could talk together about what a reasonable accommodation could look like. There is a specific form, and the expectation is that the emergency shelter or interim housing program will help the person to complete the accommodation form. It's not required that the individual is able to write it out themselves. If they're not able to, perhaps they could speak it and someone could write for them, or in other words, there may need to be reasonable accommodations in the process of completing the form. The form is both one of the handouts and also included in the 504 packet, I believe on page 22, and we're just going to look at it and simply ask for the date, shelter, the staff person working with the participant, and their name, and then what accommodation is requested, explain the reason this accommodation is being requested and how it will help with equal access to the program, and explain the resolution, the reason for granting the accommodation, proposing an alternative resolution, or denying the request. So the participant is expected to be engaged in the first two questions. What is it that they would like to see happen, and why? Again, they do not need to disclose their actual disability, simply a need that's not being addressed and how an accommodation will support inclusion. Once that piece is completed, the shelter would look to see how can we resolve this accommodation. It might be that a plan is very obviously taking hold as you are filling out this form, and that the staff member and participant are able to come up with a resolution that works very well for the shelter and the participants. It might be that in your program you have a policy where all reasonable accommodations come to a particular manager or involve another staff member in addition to the staff member supporting the person with their request. It might be that it does not seem reasonable to the shelter, and there needs to be some conversation about if the resolution is a denial, how can this person still be supported either at the shelter or in a different location, so that maybe this particular accommodation isn't possible, but a different type of accommodation might be. But essentially, this is the form that you would want to put this in writing. So just as an example, if you are already, let's say, working with a person who's vision impaired in your program, and you have found ways to accommodate them, you would want to go ahead and document that. And at this point, if it wasn't documented before, you could document now and share. In the past, we have been accommodating in this way, but you definitely would want to have something on file that shows you are making a reasonable accommodation for this person who's impacted by a disability. These are forms that DFSS can request, and I understand perhaps does request twice a year. And so we'll make sure there's a bit more follow-up on that in an email we send after. But in the meantime, you would just want to have this in the person's file. And so we wanted to highlight this is the form we're speaking of. The second handout beyond the PowerPoint is the actual longer document of policies for delegate agencies to ensure accessibilities for people impacted by a disability in a DFSS-funded shelter. So the form that we just looked at of the reasonable accommodation was one of many helpful parts of this larger packet, and wanted to pull it out to specifically look at, but this is something that all programs should have on file and look to for a great deal of wonderful follow-up ideas, brainstorming, how to help persons, different auxiliary aids and this type of thing, along with expectations from DFSS. So just wanted to highlight that if you're multitasking, please look at that. Essentially, we can go ahead and conclude on that last slide. Essentially, if we go back for just 1 second, essentially the form is submitted, the request is determined either to be reasonable or not. If it's reasonable, you've written down the resolution and you're fulfilling it. If it is not reasonable, it's important to discuss alternatives to meet the client's needs. So for example, it may not be reasonable to help a person out of bed and to the bathroom. It may be an expectation of your program that people are able to do so or are able to bring in a resource to do so. But if that is the case, that's not reasonable, when you're proposing alternatives, you might find that this person in your shelter has befriended another participant who is able to help and may even be happy to help. And you might suggest that this person who does help you get out of bed, and then perhaps in exchange you are offering a service to this person as well. There may be or simply friendship. That might be the resolution. It's really important to keep the record of the request and the accommodation. So if you are already doing something, just to go ahead and write that down so that when DFSS requests your evidence or verification that you're making these accommodations, that it's also in writing.
This slide highlights the exact point that Stephanie mentioned in the intent of the documentation in this process. And so you'll see in this workflow the particular questions that you can ask an individual who is looking to fill out a reasonable accommodation and what steps you should take as a staff. And so you'll see the two questions mentioned earlier. Do you have a disability that might make it harder for you to stay in this shelter or take advantage of any other services? And so you see what happens if the particular participant says no, the document that the client has asked and did not indicate that any disabilities that might affect the program access. You see the second question, what do you need to be able to use the shelter or its program, and how is that related to your disability? And also what to do if the person answers yes or no. So this particular workflow is also included in your packet, but we just want to highlight what those steps are. I think the important takeaway, as Stephanie mentioned earlier, is to make sure that you're clear on where the points in the process are that you need to document and how that delegate agency staff can be creative in those conversations, and then make sure that all parties are clear on the steps necessary. We just want to reiterate those checklist assessment questions for any delegate agency staff. So is the client a person with a disability? Is the requested accommodation related to the disability? Can the request accommodation be provided without creating undue financial and administrative burden to the program? Can the requested accommodation be provided without changing the fundamental nature of the program? And last, can the requested accommodation be provided without violating a state and federal statute or regulation. Clients requesting emergency shelter assistance are facing an immediate crisis and need a very rapid determination concerning any request for reasonable accommodation. For this reason, the shelter operator must quickly make a determination of the reasonableness of the request, develop alternates that can be offered if the request is not reasonable, and take action to serve the participant. The shelter operator will come to one of two conclusions. The requested accommodation or an alternate accommodation is reasonable and can be granted by the shelter. If the shelter operator determines that this request or proposed alternative is reasonable, the shelter operator lets the client know and implements the accommodation. The decision and action should be recorded on the resolution section of the request for reasonable accommodation form, which is attachment A. The requested accommodation is not reasonable for the shelter or alternate accommodation can be identified. Sometimes the shelter operator may determine that the client is a person with a disability, yet may be unable to provide the requested accommodation or accepted alternative. In this situation, the shelter operator must contact the mobile outreach team for assistance. DFSS is committed to providing shelter to all homeless clients who seek assistance. Shelters should make every effort to accommodate the disability-related requests of any person with a disability. However, if a shelter is unable to meet the needs of a client with a disability, the shelter operator must contact the mobile outreach team, which will seek ways to meet that need. We can take a pause here to see if there are any questions. So once again, if you have any questions, please go to the questions section of the webinar and type those in.
So while you're typing, we'll just offer an example, and then we'll be thrilled to see anything you wrote. If you are an operator of a family interim housing program, chances are phenomenal that you have or you will serve a family with a child who's on the autism spectrum. That spectrum is quite large, so there isn't anything that I could say that would apply to everyone on that spectrum. But in many cases, people who are on the spectrum do have sensory needs, and the way children may show that they're having a sensory need may look like a meltdown because they're experiencing an overload to their senses. So it could happen that a family may even mention that their child is on the spectrum, or that you become aware based on the behavior or based on the way the child may be struggling in this setting. As you could imagine, if this household was in their own home, the level of control that they would have of their space, in their environment, and how many visitors, and preventing chaos is so very different than the level of control they will have in a program. And so you might look to see, for example, a modification might be helping the parent to obtain some type of device for the child. It might be noise canceling earphones so that they can be in a space where there are a lot of sounds, even if they are not able to not accustomed to handling so many sounds at once because of the noise cancellation. Or if the challenge is sensory overload with sounds, there might be other ways to ensure that the way in which this household moves through the program is not with all other households. For example, they may need to eat breakfast first before everyone else does and get off to school in a way that is more calming than might otherwise be. Or if there's an expectation that families are in a particular place for meals, there may not be that expectation for this child and a parent. There might be an expectation that there's not food left in the room or something like this for pest control purposes, but that's just one type of example of many of a child who might be impacted by a disability, and a parent who may or may not advocate immediately because they would like to gain entrance to the shelter. So it may take some discussion about what needs of the child can be met in this setting, just to give an example.
Hi, this is Sue O'Neill. There was a mistake made on this screen. The email is to me, Susan, SUSAN, dot O'Neill, ONEILL, at cityofchicago.org. The fax number is 312-743-1176, and we will make sure that this is corrected when we send out the PowerPoint.
We'll also post that in the chat if you didn't write that down. Could look in the chat for that in a minute or two.
Yes, I think the intent on the previous slide was to make sure that we're documenting things in the process, and that process also includes that of any denials or appeals. And so these policies are effective immediately. The Department of Family and Support Services have been working very hard to make sure that all shelters are working together and have consistent operations throughout the city. And we also want to make sure that we are leaving people with very key takeaways from this particular webinar. So it's important to understand that develop, document in writing, and train staff on reasonable accommodation procedures, including appeals. That's why many of you are here today with us this morning, and that these policies are applied throughout the entire system, that any documentation for other licensed professionals are not necessary in the reasonable accommodation process, but that any documentation should be included in the process. Accommodation requests tied to the disability is what we want to highlight in the request that a participant or client is making, and that our goal is to screen people into the supports and services that they need and not out. At this time, we also are including Susan's contact information in the chat box, so you'll see her email address along with that fax number. At this time, we are almost near the end of the webinar, and we want to make sure that people have an opportunity to ask any other questions, make any other comments, or ask something that wasn't possibly clear to them during this webinar. So we're going to take a couple seconds for folks to ask those questions.
While you're typing that in, this webinar was recorded and will be available to you, and it'll be on the DFSS page. Also, it will be sent out as an email so that you can see later how to access the recording and the documents. If there's participants or staff at your shelter, I should say, who didn't have the opportunity to listen in, they'll be able to do so at their convenience. Or if you would like a refresher on any of this, you're welcome to come back and join us anytime. So now we'll look to see if we missed a question.
We do have another question. It asks, any advice on the DHS approving folks for home assistance in a long-term shelter environment or sub-housing?
Well, I'm not sure. Let me find out, and I will get back to everyone who signed up for this webinar, and I apologize for not knowing the answer right away. Any other questions? Any other typed in questions?
We're going to pause for a second and put ourselves on mute to give folks an opportunity to type. So we have not left the webinar. We're just going to pause for folks to ask questions at this time. We want to take this opportunity to inform people that CSH also has an online training center. If people are looking to learn more about the supportive housing sector, to learn more about sort of our coordinated work around housing systems and shelters, please feel free to visit our online training center. You see the website is there. And lastly, we just want to thank everybody for participating today. We had, I believe, well over 50 attendees on a webinar. As we mentioned, this webinar is being recorded, and so it can be accessed later on the DFSS website, as well as being emailed to everyone who participated and registered. So thank you again on behalf of myself, Jonna Lowe, and Stephanie Simon from CSH. And then we want to leave you with Susan's contact information.
Okay, this will be included in the PowerPoint we're going to send out, but again, I'm Susan O'Neill. I'm the DFSS project coordinator with the Homeless Division. My direct line is 312-746-9448. And then you already have in the chat box, my email address. So thank you so much for signing up and attending this webinar. We really appreciate the work that you do with our homeless population. Thank you.